Hi, I'm Katie Manning. I'm a mental health coach intern with the Hope and Healing Center in Houston, Texas. We realize that a lot of people are self-quarantining right now, which can be really difficult, and even more so if you're living with a mental illness. Some different mental health diagnoses make it really hard to be by yourself, so we wanted to kind of offer some practical advice to address some of the things you may be dealing with. We're going to do a few videos on things like the importance of maintaining a routine, on recognizing your cycles and triggers that you may be experiencing, and then just on general anxiety that you might have surrounding the COVID-19 outbreak. This current video is about cycles and triggers. Cycles are things that you go through usually when you have a mental health diagnosis. It can be a period of reduced symptoms that are really under control, or it can be a period of more exacerbated or extreme symptoms that feel a little worse and harder to control. Triggers are things that exacerbate mental health symptoms. So it's something like, it could be something like sleeping too much or too little could send someone into a little bit of a deeper depression, or being really excited or anxious might trigger a manic episode. So there's things that happen that we can pay attention to and then be aware of so that we know that maybe an episode is coming that's going to be a little worse, or symptoms may be a little bit harder to control, or things that you can kind of get ahead of. So that's why this is so important. If you're unsure what things happen that lead to worsening symptoms for you, you can ask your mental health provider if you have them, like a psychiatrist or a therapist. You can also ask loved ones. Anybody who's basically been around you for any kind of extended period of time is a good person to ask about these things. They'll probably have noticed a pattern over time. In keeping symptoms in check, something that's really important to do is to make sure that you have all the medications you need if you are taking medications. So making sure you have medications for at least like a month in case we are needing to stay at home longer. And something you can do for that if you don't have enough medications is contact your psychiatrist. Your psychiatrist's office probably already has a plan set up for this situation by now, so you can call them and see what their plan is for their clients who are running out of medications or running low or just struggling with them in general. If you normally see a therapist in person, see if there's a way that you can talk to them otherwise, such as over the phone, maybe even via email or video conferencing if they have access to that. If not, there are other resources available. There are virtual support groups you can check out. Support Group Central has great ones for a lot of different mental health diagnoses. Some are free and some are low cost, and they even offer some in Spanish. So you can Google that name, Support Group Central, or go to supportgroupscentral.com. So that's SUPPORTGROUPS central.com. Another option, if you're experiencing a mental health crisis, if you know you're past that trigger point and you're already in a crisis, you can go to one of Memorial Hermann's crisis clinics in the Houston area. There are 3. I would recommend Googling that. Google Memorial Hermann Crisis Clinic, and then find the one nearest to you, check out their hours, and give them a call first just to see if they have any procedures in place for COVID-19 to maintain everyone's safety. Memorial Hermann Crisis Clinics offer low-cost services such as psychiatric services for the short term. They're trying to stabilize people and make sure that they can get access to help, but that's a good place to go if you're experiencing a crisis. They should be able to help you out as long as they are still open. So just make sure you call first because things are changing really rapidly right now. If you're feeling suicidal or having any thoughts of killing yourself, if you're in an emergency situation, please call 911. If you need someone to talk to because you think you might become suicidal or you're getting close to acting on some thoughts, call the National Suicide Prevention Lifeline. That number is 1-800-273-8255. Remember, this is a really difficult time for a lot of people. It's so important to be aware of what's going on with your emotions and your sort of internal dialogue and your symptoms. So please keep track of those cycles and triggers. Make sure you have enough medication. Try and find alternate ways to seek therapy if you need to, and call someone if you need help or if you're feeling severely suicidal. We are alone as far as we're distanced physically, but we are all in this together. Take care.